Hello and welcome. Today we're diving into the fascinating, yet sometimes challenging, world of cranial nerve palsies. These conditions affect the delicate nerves that emerge directly from the brain, controlling vital functions from eye movement to facial expressions. Understanding them is key to proper diagnosis and management. So, what causes these palsies? The etiologies are diverse. Trauma such as head injuries can directly damage these nerves. Infections like Lyme disease, herpes zoster, or meningitis can inflame or compromise nerve function. Vascular issues, such as stroke or aneurysms, can interrupt the blood supply to the brainstem, where many cranial nerves originate. Tumors, pressing on or invading the nerves, are another potential cause. Finally, certain systemic diseases like diabetes and multiple sclerosis can also contribute to the development of cranial nerve palsies. Let's explore the pathophysiology. Cranial nerve palsies occur when there's damage to or dysfunction of one or more of the 12 cranial nerves. Each nerve has a specific pathway and function. The damage can occur at any point along that pathway, from the brainstem nucleus where the nerve originates, to the nerve itself as it travels through the skull, or even at its target destination, like a muscle or gland. This damage can lead to a disruption in the nerve's ability to transmit signals, resulting in weakness or paralysis of the muscles it controls, or sensory deficits in the areas it innervates. How common are these conditions? The epidemiology of cranial nerve palsies varies depending on the specific nerve affected and the underlying cause. Bell's palsy, affecting the facial nerve, is relatively common. Oculomotor nerve palsies are often seen following trauma or vascular events. The incidence of each palsy also differs based on age, geographic location, and the presence of predisposing conditions like diabetes. Statistical data on the precise prevalence of each type of cranial nerve palsy are continuously being updated with ongoing research. The signs and symptoms of cranial nerve palsies depend entirely on which nerve or nerves are affected. For example, an oculomotor nerve palsy can cause double vision, a drooping eyelid, and difficulty moving the eye. A facial nerve palsy, as seen in Bell's palsy, often presents with facial drooping, difficulty closing one eye, and altered taste sensation. A trigeminal nerve palsy might cause facial numbness or pain. Glossopharyngeal nerve palsy can result in difficulty swallowing and loss of taste. Vagus nerve palsy may cause hoarseness and difficulty speaking. Symptoms can range from mild and transient to severe and permanent, significantly impacting a person's quality of life. Diagnosing cranial nerve palsies involves a thorough neurological examination. This typically includes assessing eye movements, facial muscle strength, hearing, balance, speech, and swallowing. Imaging studies like MRI or CT scans are often used to visualize the brain and cranial nerves, helping to identify any structural abnormalities such as tumors or aneurysms. Blood tests may be ordered to rule out underlying infections or systemic diseases. In some cases, electrophysiological studies, such as electromyography (EMG), might be used to evaluate nerve function. While not always categorized as distinct types, cranial nerve palsies are often grouped by the specific nerve affected. For example, we talk about oculomotor nerve palsy, facial nerve palsy, abducens nerve palsy, and so on. In addition, each individual nerve palsy can further be classified based on the underlying etiology. For instance, a facial nerve palsy could be labeled as Bell's palsy, idiopathic, or facial nerve palsy secondary to Lyme disease. Understanding the specific nerve and cause helps guide treatment decisions. Treatment and management depend on the underlying cause and the severity of the symptoms. If the palsy is due to an infection, antibiotics or antiviral medications may be prescribed. For palsies caused by tumors or aneurysms, surgery or radiation therapy might be necessary. In many cases, supportive care, such as eye patch for double vision or lubricating eye drops for dry eyes, can help manage symptoms. Physical therapy can be beneficial for regaining muscle strength and coordination. In some cases, medications like corticosteroids may be used to reduce inflammation and swelling around the nerves. Preventing cranial nerve palsies is often challenging, as many causes are unpredictable. However, certain measures can help reduce the risk. Practicing good hygiene can help prevent infections that could lead to palsies. Managing underlying conditions like diabetes can reduce the risk of nerve damage. Wearing appropriate safety gear during activities that could lead to head injuries can also be beneficial. Prompt medical attention for any symptoms suggestive of cranial nerve dysfunction is essential for early diagnosis and treatment. The prognosis for cranial nerve palsies varies widely depending on the underlying cause, the severity of the nerve damage, and the individual's overall health. Some palsies, like Bell's palsy, often resolve on their own within a few weeks or months. Others, especially those caused by severe trauma or tumors, may result in permanent deficits. Current research is focused on developing new treatments to promote nerve regeneration and improve functional outcomes. For example, Studies are investigating the potential of neurotrophic factors and stem cell therapies to enhance nerve repair after injury.